Rift Valley fever, RVF, is a viral zoonosis that primarily affects animals but can also infect humans. The majority of human infections result from contact with the blood or organs of infected animals. Human infections have also resulted from the bites of infected mosquitoes. To date, no human-to-human transmission of RVF virus has been documented. The incubation period, the interval from infection to onset of symptoms, for RVF varies from 2 to 6 days. Outbreaks of RVF in animals can be prevented by a sustained program of animal vaccination. Rift Valley fever, RVF, is a viral zoonosis that primarily affects animals but also has the capacity to infect humans. Infection can cause severe disease in both animals and humans. The disease also results in significant economic losses due to death and abortion among RVF-infected livestock. RVF virus is a member of the Fluvivirus genus. The virus was first identified in 1931 during an investigation into an epidemic among sheep on a farm in the Rift Valley of Kenya. Since then, outbreaks have been reported in sub-Saharan Africa. In 1977 an explosive outbreak was reported in Egypt. The RVF virus was introduced to Egypt via infected livestock trade along the Nile irrigation system. In 1997-98, a major outbreak occurred in Kenya, Somalia and Tanzania following El Niño event and extensive flooding. Following infected livestock trade from the Horn of Africa, RVF spread in September 2000 to Saudi Arabia and Yemen, marking the first reported occurrence of the disease outside the African continent and raising concerns that it could end to other parts of Asia and Europe. The majority of human infections result from direct or indirect contact with the blood or organs of infected animals. The virus can be transmitted to humans through the handling of animal tissue during slaughtering or butchering, assisting with animal births, conducting veterinary procedures, or from the disposal of carcasses or fetuses. Certain occupational groups such as herders, farmers, slaughterhouse workers, and veterinarians are therefore at higher risk of infection. The virus infects humans through inoculation, for example via a wound from an infected knife or through contact with broken skin, or through inhalation of aerosols produced during the slaughter of infected animals. There is some evidence that humans may become infected with RVF by ingesting the unpasteurized or uncooked milk of infected animals. Human infections have also resulted from the bites of infected mosquitoes, most commonly the Aedes and Culex mosquitoes, and the transmission of RVF virus by hematophagous, blood-feeding flies is also possible. To date, no human-to-human transmission of RVF has been documented, and no transmission of RVF to healthcare workers has been reported when standard infection control precautions have been put in place. There has been no evidence of outbreaks of RVF in urban areas. Following are clinical features of the mild form of RVF in humans. The incubation period, the interval from infection to onset of symptoms, for RVF varies from 2 to 6 days. Those infected either experience no detectable symptoms or develop a mild form of the disease characterized by a feverish syndrome with sudden onset of flu-like fever, muscle pain, joint pain and headache. Some patients develop neck stiffness, sensitivity to light, loss of appetite, and vomiting. In these patients the disease, in its early stages, may be mistaken for meningitis. The symptoms of RVF usually last from 4 to 7 days, after which time the immune response becomes detectable with the appearance of antibodies and the virus disappears from the blood. While most human cases are relatively mild, a small percentage of patients develop a much more severe form of the disease. This usually appears as one or more of 3 distinct syndromes: ocular eye disease, 0.5 to 2% of patients, meningoencephalitis, less than 1% of patients, or hemorrhagic fever, less than 1% of patients. The following are clinical features of the severe form of RVF in humans. Ocular form. In this form of the disease, the usual symptoms associated with the mild form of the disease are accompanied by retinal lesions. The onset of the lesions in the eyes is usually 1 to 3 weeks after appearance of the first symptoms. Patients usually report blurred or decreased vision. The disease may resolve itself with no lasting effects within 10 to 12 weeks. However, when the lesions occur in the macula, 50% of patients will experience a permanent loss of vision. Death in patients with only the ocular form of the disease is uncommon. Meningoencephalitis form. The onset of the meningoencephalitis form of the disease usually occurs 1 to 4 weeks after the first symptoms of RVF appear. Clinical features include intense headache, loss of memory, hallucinations, confusion, disorientation, vertigo, convulsions, lethargy and coma. Neurological complications can appear later, after more than 60 days. The death rate in patients who experience only this form of the disease is low, although residual neurological deficit, which may be severe, is common. Hemorrhagic